Welcome to Drugs and Dermatology. In this video, we will be discussing the only current FDA-approved anti-interleukin 36 agent relevant to dermatology, Spesolimab. This is the first and only FDA-approved biologic for generalized pustular psoriasis. An important note is although this class of drugs may be utilized for a wide range of treatments, we will be looking through a dermatology lens focusing on dermatological diseases that are FDA approved. So, let's break it down, drugs in dermatology style. The drug Spesolimab, with the brand name Spevigo and developed by Boehringer Ingelheim, is a humanized IgG1 monoclonal antibody that specifically targets the interleukin 36 receptor, blocking the interleukin 36 signaling pathway that is a key driver of generalized pustular psoriasis, also known as GPP. It is the only FDA-approved targeted therapy for GPP. GPP is a rare chronic autoinflammatory skin disease distinct from plaque psoriasis. It is characterized by recurrent flares of widespread sterile neutrophilic pustules, erythema, and desquamation. Flares can progress rapidly to life-threatening complications, including sepsis, fluid and electrolyte imbalances, and cardiorespiratory failure. Spesolimab is available in two formulations for two distinct clinical settings: intravenous administration for the treatment of acute GPP flares, and subcutaneous administration for maintenance therapy to prevent flare recurrence. Phase 1 studies between 2015 and 2018 established a favorable pharmacokinetic and safety profile. A Phase 1 study in 7 GPP patients in 2019 demonstrated 100% skin clearance by week 4. The pivotal EFISAIL-1 Phase 2 trial demonstrated superiority over placebo at week 1 for pustular clearance in adults with acute GPP flares, leading to FDA approval for intravenous Spesolimab in September 2022. The eventual EFISAIL-2 Phase 2b trial established the efficacy of subcutaneous Spesolimab for flare prevention over 48 weeks, resulting in a supplemental FDA approval in 2024 for subcutaneous Spesolimab as maintenance therapy in adults and pediatric patients aged 12 years and older. The drug Spesolimab holds a single FDA-approved indication with two treatment settings, both within generalized pustular psoriasis. For the treatment of GPP flares, intravenous Spesolimab is indicated in adults and pediatric patients aged 12 years and older. For the prevention of GPP flares, subcutaneous Spesolimab is indicated in the same population. Spesolimab has no FDA-approved indications outside of GPP. It is not approved for plaque psoriasis or pustular psoriasis variants other than GPP. The interleukin 36 cytokine family comprises 3 receptor agonists, including interleukin 36 alpha, interleukin 36 beta, and interleukin 36 gamma, and 1 endogenous antagonist. When the interleukin 36 receptor antagonist is absent or deficient, balance between interleukin 36 agonism and antagonism is disrupted, allowing unchecked interleukin 36 activation. The drug Spesolimab binds specifically to the interleukin 36 receptor at a site distinct from both the endogenous agonist and antagonist, thereby blocking all interleukin 36 receptor activation regardless of which agonist is driving the signal. By interrupting this autoinflammatory cycle, Spesolimab causes rapid downregulation of neutrophilic mediators, keratinocyte-driven inflammation, and Th1 and Th17 immune signatures. Regarding the intravenous formulation, the most common adverse reactions include fatigue, headache, nausea, pruritus, infusion site reactions, and urinary tract infection. For the subcutaneous formulation, the most common adverse reactions are injection site erythema, urinary tract infection, arthralgia, and pruritus. The most clinically serious adverse effects are hypersensitivity reactions, including DRESS and anaphylaxis, and Guillain-Barré syndrome. The only absolute contraindication is severe or life-threatening hypersensitivity to Spesolimab or any excipient. Furthermore, do not initiate during active serious infection, screen for TB pre-treatment, and avoid inactive TB. Avoid live vaccines during treatment and for at least 16 weeks after the last dose, and complete all age-appropriate vaccinations prior to initiation. As always, we will close our video with a table going over the main talking points. The interleukin-36 inhibitor we discussed was Spesolimab. I hope you have a better understanding of anti-interleukin-36 therapies. This is meant for educational and informational purposes only and should not be used as a substitute for medical advice, diagnosis, or treatment. Thank you for watching, and see you in the next video.